Hello everyone. Today we will be discussing the drugs used in psychiatric illnesses, and this will be the first lecture of this series. So, in this lecture, we will be discussing what is psychosis, what are the different types of psychiatric illnesses, what is the etiology of schizophrenia vis-a-vis. We will be discussing the dopamine hypothesis, the glutamate hypothesis, and serotonin hypothesis. Apart from this, we will be discussing the classification of antipsychotic drugs. In detail, we will discuss about the antipsychotic drugs in the next lecture. So first coming to what is psychosis. So psychosis is derived from two words. One is psyche, which means mind or soul, and phosis, which means abnormal condition or derangement. Okay. So psychiatric illnesses, they can be classified as either psychosis or neurosis. Now, psychosis are those conditions in which there is no insight, and neurosis are those conditions where insight is present. So, what we mean by this term insight? So, insight, it means that it is awareness of the illness. The patient will know that he or she is ill in case of neurosis, and these are the generalized anxiety disorder, the various kinds of phobias, OCD, bulimia, PTSD. Okay, so these are all the examples of neurosis in which the patient is aware that he is having certain kind of illness. Whereas in case of psychosis, there is no insight. That means the patient is unaware that he is having any kind of illness. And this is broadly classified into one is schizophrenia and the other one is affective disorders. And in the affective disorders, we have mania, we have depression, or we can have bipolar disorder, where the person switches between mania and depression. So this is all about the classification of psychiatric illnesses. Now coming to the most important point or most important disease in this, that is schizophrenia. So in schizophrenia, we all know that there can be positive symptoms or negative symptoms, or a person can have cognitive symptoms. So what are the positive symptoms? These can be delusions, hallucinations, conceptual disorganization, suspiciousness. In the negative symptoms, we have affective flattening, alogia, anhedonia, and in the cognitive symptoms, we have impaired attention, impaired working memory, we have impaired executive function. So coming to the different theories of schizophrenia. So we know that the schizophrenia can either be caused due to genetic predisposition plus environmental, social, and psychological factors. And these both may lead to neurodevelopmental abnormalities and features. Which leads to brain dysfunction and chemical imbalance in the brain. So this is more or less the etiology of schizophrenia. Now coming to the various hypotheses which were formulated about psychiatric illnesses or schizophrenia. So broadly, there are three hypotheses. Dopamine hypothesis, next is glutamine hypothesis, and serotonin hypothesis. So these three are important neurotransmitters that are involved in schizophrenia: dopamine, glutamine, and serotonin. So first, let us come to the dopamine hypothesis. So we know that dopaminergic system, there are four pathways. Four pathways are there in the brain. And what are these four pathways? These four pathways are the nigrostriatal pathway, the mesolimbic pathway, mesocortical pathway, and fourth is the tuberoinfundibular pathway. So nigrostriatal pathway, mesolimbic pathway, mesocortical pathway, and tuberoinfundibular pathway. So what the dopamine hypothesis states, it states that the positive symptoms of schizophrenia, the positive symptoms of schizophrenia, they are due to the overactivity of the mesolimbic pathway, which activates the D2 receptors. Then the negative symptoms of schizophrenia, they are due to the, or they are the result of decreased activity in mesocortical pathway. And here, which receptors are involved? The D1 receptors are involved. Now, nigrostriatal and tuberoinfundibular pathways, they appear to be normal in schizophrenia. Nigrostriatal and tuberoinfundibular appear to be normal in schizophrenia. Coming to the glutamate hypothesis. So in the glutamate hypothesis, what happens is that the neurotransmitter which is implicated is glutamate. And the evidence of this hypothesis is based on the findings that the glutamate NMDA receptor antagonists like phencyclidine and ketamine, they both cause psychotic symptoms in normal subjects when administered. So what we have found out that NMDA receptors is responsible for the negative symptoms of the schizophrenia. So NMDA receptor underactivity is responsible for the negative symptoms of schizophrenia. So N for N, NMDA receptor underactivity is responsible for negative symptoms. Now coming to the serotonin hypothesis. So serotonin hypothesis, it states that the hallucinatory effects of LSD was due to the 5-HT2A receptor activation. Okay, 5-HT2A and 5-HT2C receptor activation. And the atypical acyclotics, they antagonize the 5-HT2A receptor antagonists are the atypical antipsychotics. So these were the three hypotheses of schizophrenia. One is the dopamine hypothesis, the glutamate hypothesis, and serotonin hypothesis. Now coming to the drugs proper. So antipsychotics or neuroleptics. Antipsychotics, or they are also known as neuroleptics. So antipsychotics or neuroleptics, the first one to be identified was chlorpromazine. Okay, and this antipsychotics, they are divided into two broad categories. One is typical antipsychotics, and the other one is atypical antipsychotics. So, which are the typical antipsychotics? These have high affinity for D2 receptors. Okay, so D2 blockade by 5-HT2A blockade is greater than 1. These are typical antipsychotics. Whereas those which act by other mechanism or for whom the D2 blockade by 5-HT2A blockade is less than 1, these are atypical antipsychotics. So what are the drugs in the typical antipsychotics? So this may be phenothiazines, thioxanthines, the deuterophenones, or miscellaneous. So phenothiazine are again divided into three categories with aliphatic side chain, with piperidine side chain, and those with piperazine side chain. So aliphatic side chains, these are chlorpromazine and triflupromazine. Triflupromazine. With piperidine side chain is thioridazine. And piperazine side chain is trifluoperazine and fluphenazine. Next, coming to thioxanthines. So thioxanthines are thiothixin and flufenthixol. Then the butyrophenones, they are haloperidol, droperidol, trifluperidol, fenfluridol. And the miscellaneous drugs are pymoside, loxapine, molindone. Okay, this is the classification of typical antipsychotics. Now coming to the what are the atypical antipsychotics. So the antipsychotics, which are atypical, they have, as we have already discussed, low affinity for D2 receptors, or in those the D2 blocking by 5-HT blockade is less than 1. So this there are three categories. They end with either pin or done. Or apart from that, there are two prazoles are there. Okay. So the drugs which end with pin are clozapine, olanzapine, quetiapine, escenapine. The drugs with end with done are paliperidone, iloperidone, and ziprasidone. And then next prazoles, aripiprazole, brexpiprazole, and another newer drug is there, pimavanserin. So these are the atypical antipsychotics which have low affinity for the D2 receptors. And another point I would like to highlight is that the drugs which have the high potency, they have the low anticholinergic and autonomic side effects and have more likely to cause the extrapyramidal symptoms like haloperidol. Haloperidol, it has the highest potency and it has got more of extrapyramidal symptoms. Whereas the drugs which have low potency, like the thyroidazine, they have the least risk of EPS among the typical drugs. So these are weak D2 blocking drugs among the typical. Thyroidazine is a weak D2 blocking drug. Thyroidazine and chlorpromazine, these are weak D2 blocking drugs. Whereas the strong D2 blocking drugs have the highest EPS, and the highest is for haloperidol. Whereas the least risk of EPS is for thyroidazine. So H for H, you can remember. Haloperidol has highest EPS. So that was all about the today's lecture, which was about the classification of the psychiatric illnesses. What are the different hypotheses in the psychiatric illnesses vis-a-vis your dopamine hypothesis, the glutamate hypothesis, and serotonin hypothesis? Then we classified the antipsychotic drugs. The antipsychotic drugs, basically they are of two types. One is typical, one is atypical. What are the typical drugs? The typical drugs are those drugs which have a high D2 blockade, and D2 blockade by 5-1, 5-2, sorry, blockade is greater than 1. So these are again divided into phenothiazines, the thiazanthines, butyrophenones, and miscellaneous drugs. So in the phenothiazines, we have the aliphatic side chains, the piperidine side chain, and piperazine side chain. In the aliphatic side chain, we have chlorpromazine and triflupromazine. Piperidine side chain, we have thioridazine, and piperazine side chain, we have trifluperazine and fluphenazine. In the thiazanthines, we have thiothixine and fluphenthixol. In the butyrophenones, we have haloperidol, droperidol, trifluperidol, and fenfluperidol. In the miscellaneous, we have pimozide, loxapine, molindol. In the atypical drugs, we have either pin or done. So the drugs which end with pin are clozapine, olanzapine, quetiapine, escenapine, and the drugs which end with done are paliperidol, iloperidol, ziprasidone, and risperidone. The drugs with end with prazoles are aripiprazole, rexpiprazole, and another new drug is added, that is pimavanserin. Okay, so this was all about today's lecture. In the next lecture, we'll discuss what are the side effects of the antipsychotic drugs and what are the uses. Thank you.